The shoulder is a complex joint with a wide range of motion, allowing us to perform various activities. This extensive range of motion makes it prone to various injuries and conditions, such as rotator cuff tears, impingement, and bursitis. The shoulder X-ray is often the first imaging test ordered when a patient presents with shoulder pain, stiffness, or deformity, providing a quick and non-invasive way to assess the issue. It provides valuable information about the bones that make up the shoulder joint, including the humerus, scapula, and clavicle. These images help clinicians diagnose fractures, dislocations, arthritis, and other bone abnormalities, which are crucial for determining the appropriate treatment plan. Understanding how to properly obtain and interpret shoulder X-rays is essential for medical students, as it forms a fundamental part of their training. This guide will provide a comprehensive overview of shoulder X-rays, ensuring that students and practitioners alike can master this important diagnostic tool. We will cover basic anatomy, standard views, image interpretation, common findings, potential pitfalls, and tips for success, making sure you have all the necessary knowledge. By the end of this guide, you will have a solid foundation in shoulder X-ray interpretation, enabling you to make accurate diagnoses. You will be well equipped to confidently approach shoulder X-rays, enhancing your diagnostic skills and improving patient outcomes. The shoulder is made up of 3 bones: the humerus, the scapula, and the clavicle. These bones are essential for the shoulder's structure and function. These bones come together to form the glenohumeral joint and the acromioclavicular joint, which are crucial for shoulder movement and stability. The glenohumeral joint is a ball and socket joint, allowing for rotational movement. It allows for a wide range of motion, making it one of the most flexible joints in the body. The AC joint is a gliding joint, which permits slight movement. It connects the clavicle to the acromion process of the scapula, providing additional support. When ordering or taking a shoulder X-ray, it's crucial to specify the area of concern to get accurate results. This ensures the appropriate views are taken, aiding in proper diagnosis. For instance, if a patient presents with pain at the top of their shoulder, a focused view of the AC joint might be necessary to identify the issue. Several standard views are used to evaluate the shoulder, each providing unique insights into the shoulder's anatomy and potential issues. The most common views are essential for a comprehensive assessment of the shoulder joint. Antero-posterior (AP) view. This view is taken with the patient's arm rotated outward, providing a clear image of the shoulder's front. It shows the humeral head, glenoid fossa, and proximal humerus, which are crucial for diagnosing fractures and other abnormalities. Lateral view. This view is taken with the patient's arm at their side, offering a different perspective. It shows the relationship between the humeral head and the glenoid fossa, aiding in the evaluation of joint alignment. It is also useful for assessing the acromion process, which can be involved in impingement syndromes. Y view. This view is taken with the patient's arm abducted and rotated outward, providing a unique angle. It gets its name from the Y shape formed by the scapula, clavicle, and humerus, making it easy to identify dislocations. This view is particularly helpful in assessing for dislocations and other structural abnormalities. In some cases, additional views may be ordered to get a more detailed look at specific areas. These may include axillary views or apical oblique views, which provide different angles and details. These additional views help visualize specific areas of the shoulder in greater detail, ensuring a thorough evaluation. Interpreting a shoulder X-ray involves a systematic approach. Check patient details. Ensure the X-ray belongs to the correct patient. Verify the date and time the X-ray was taken. Assess image quality. The image should be clear and in focus. It should include all relevant anatomy. Evaluate the bones. Look for any fractures, dislocations, or other abnormalities. Examine the joints. Assess the joint spaces for narrowing, widening, or other irregularities. Review soft tissues. While X-rays primarily show bones, pay attention to any obvious soft tissue swelling or calcifications. By following this systematic approach, you can ensure a thorough and accurate interpretation of shoulder X-rays.